Alrighty, my friends, today is day 36. Day 36. We are in the 6th and final week of boot camp. Graduation is in sight. Do not get graduation fever. Do not get graduation fever. Now is the time for your fortitude, for your resolve, for your commitment, for your faith, for your to be even stronger. Okay, we got 1 week to go till the end of boot camp. Okay, you guys are doing great. You've done 5 weeks, 35 amazing days, and I hear from so many of you how much better you're feeling physically, emotionally, intellectually, spiritually, etc., etc., etc. Okay, and we want to keep this going as this program continues. As you continue on this program, okay, so shall your results deepen. So shall your improvements continue and deepen and greaten. They will greaten like potatoes au gratin. Don't let me get you thinking about potatoes with cheese. It's the enemy, my friends. It's the enemy, okay? But we want to deepen your commitment, deepen your resolve, deepen the results. Keep the train on the track. Keep the motivation running. Keep this plane in the air, okay? You can do it. You can do it. You're already doing it, but guess what? You can do even better, okay? You probably didn't even think you could come this far, okay? If you could come this far, you can come even further, okay? We got a great week lined up for you. We got the respiratory therapist laureate, Mark Mangus. We got the mother of modern chest physical therapy and pulmonary rehabilitation, Donna Fraunfelter. We got Marion Mackless doing the aerobics, the breathing aerobics, okay? And I'm going to show you some of my other team members, okay? I'm going to introduce you to some other guys, and we're going to start getting ready for what happens after boot camp, because guess what? This is only the beginning, people. This is the kickoff, okay? We've built this house, now we're going to live in it, and we're going to decorate it. We're going to make it nicer. We're going to make it more beautiful. We're going to make it more powerful. We're going to make it more comfortable. Increase the peace, my friends. Increase the peace. Have a great day. Day 36. You can do it. Yes, you can. We can do it. Yes, we can, my friends. Keep it coming. All right. Today's question of the day. So today's question of the day is a very common question. It's asked over and over and over again through the ages in many different ways. So I thought I would take a little bit of time to address it head on. This question has to do with oxygen saturation and shortness of breath. And it often goes something like this. Why is it that my oxygen saturation can be 96% and yet I am still short of breath? So here is a question for the ages that often goes like this. Why am I still short of breath if my oxygen saturation is 93, 94, 95, 96, 97? Great question. I can understand why you would find this a strange occurrence. So this goes back to a concept that I talk about over and over and over again, dating back centuries, which is the idea that breathing is a multifactorial process. And what I mean by that is that there are many, many, many factors that go into how well or how poorly we breathe. Now, the fact that your oxygen saturation is okay is certainly a lot better than your oxygen saturation not being okay and you being short of breath. So for example, if somebody's in respiratory distress and their oxygen saturation is 80%, well, obviously that's a much greater concern. And this tells us that their system, okay, their entire body system is unable to meet the demands of whatever situation may be going on at the time. So if the person is resting and their oxygen saturation is below 90%, then certainly this person needs to be wearing oxygen at rest, okay? If the person is actually moving around or exercising, then what that tells us is that not only does the person need to be wearing oxygen, but that if they are wearing oxygen, that the amount of oxygen or the type of unit that they're using or the type of delivery device, be it either a cannula or a mask or something else, is not adequate to meet their demands. And so we have to figure out what can we do to increase the supply in order to meet their demands. So the keys are, there are many things that can cause your shortness of breath. So for example, if you have obstructive pulmonary disease, then airway mechanics can cause your shortness of breath. However, the fact that your oxygen is 96% is telling us that despite your challenge in airway mechanics, your body is still able to make up for and overcome those challenges and keep you well saturated. Now, in respiratory disease that involves restrictive diseases, okay, people can be short of breath also because of poor ability to fill the lungs. But again, they can still have adequate oxygen saturation. In other words, at rest, when they're sitting, even if they're short of breath, they may be adequately saturated. However, with the restrictive diseases, more so than even the obstructive diseases, it's during activity when the person gets up to walk around that we see a very, very big drop often in oxygen saturation. As far as pulmonary hypertension, that's a different story as well. But again, it has to do with how does the body use oxygen. It has to do with how does the body deliver oxygen from the lungs to the blood, okay? But again, you can be short of breath and still have adequate oxygen saturation. The body has many, many checks and balances that are there to make sure that we remain okay and remain alive, essentially, what we're saying. Now, when that demand exceeds the ability of our body and whatever additional equipment we're using to help it meet that demand, it can still be overcome. It can still be overcome. The demand can be too great. And even with these different devices, we may not be able to maintain adequate saturation, in which case we must consider going up a level in terms of what we're using, okay? Whether that be going from pulse to continuous, whether that be going from a cannula to a mask, whether that be going from a portable to a stationary concentrator, whether that be going from a stationary concentrator to a tank. And there's many, many different considerations there, all with various nuances, okay? But when we think about it, what are some things that can cause us to be short of breath, even if our saturation is okay? So we talked about the obstructive diseases, and we talked about the fact that even though you have a challenged airway, and even though we have increased obstruction and poor airway mechanics, we can still maintain adequate saturation. In restrictive diseases, usually at rest, even though we have difficulty bringing air in, we have trouble taking a deep breath, we can still often maintain adequate saturation, particularly at rest. With pulmonary hypertension, even though there's increased resistance in the pulmonary circulation and in the pulmonary capillary beds, we can still often maintain adequate saturation, particularly at rest. We can be short of breath because we're out of shape, and that wouldn't necessarily drop our saturation. We can be short of breath because we've gained weight. That wouldn't necessarily drop our saturation. We can be short of breath because the activity that we're doing is too difficult for us, or is difficult to us because our bodies are not tuned up. And this relates to also just being out of shape versus, also being out of shape, being deconditioned. But again, it's telling us that even though carrying these 4 packages up 3 flights of stairs is very, very difficult to us and is certainly a strain on our bodies are still able to work around that and maintain adequate saturation. So again, Don't be disappointed if you're short of breath but your saturation is good. That's better than certainly you being short of breath and your saturation being bad. But this topic, even though it's an answer to that question, is really a discussion about how do you maintain proper saturation, and when you do desaturate, what is okay, and when do you need to consider supplemental oxygen, and what kind of supplemental oxygen should you be using. So in other words, should you be using pulsed or continuous? Should you be using a portable oxygen concentrator versus a stationary concentrator that you plug into a wall? Should you be using a stationary versus a tank with 100% medical grade oxygen in it? Should you be using a cannula or a mask? Okay, these are all things that can and should be investigated in every patient who has issues maintaining saturation. In addition, okay, patients should be taught when it's okay to turn their oxygen up, when it's okay to leave it at a certain level, and what parameters are okay for them to go to. So I read something today where somebody said, okay, well, your oxygen only goes to 85%, therefore you don't need oxygen. And I was like, what? As you know, my belief is that, we need to keep people's oxygen at least 93%, okay? Why? Okay, a number of different reasons. First of all, the body doesn't do well when it doesn't get enough oxygen. When the demand outweighs the supply, the body doesn't do well and starts to make adaptations. It increases your risk for coronary ischemia, increases your risk for arrhythmia, increases your risk for heart failure, and it's just something that shouldn't be played with. When you have a chronic pulmonary disease or a chronic cardiovascular disease or anything of the sort, you don't want to play around with it. You don't want to be like, well, we're probably going to be okay. And you also don't want to, it's like if you were traveling across the desert with your grandmother, would you be like, well, yeah, Granny could carry one more package? No, you want to protect Granny. You want to make sure that she's able to do what she could do with as little strain as possible. Think of your heart and your cardiovascular and your respiratory system as Granny, okay? Protect her. Treat her with respect. Treat her as if you want her to stick around for as long as humanly possible, okay? Get it? All right. So these things, okay, while I'm not going to go into the exact of how do you determine how much oxygen you need at this moment, because it's not a 2-second answer, okay? But just keep in mind that these things should be evaluated and can easily be evaluated if the people who are taking care of you have an interest in evaluating these things. And just one more point is that a lot of times people are tested and their vital signs are taken before the test and after the test. And I just want to say that makes no sense. We need to get measurements on you of heart rate, heart rhythm, blood pressure, oxygen saturation during exercise itself. Okay, if we want to know how a plane handles being 50,000 feet in the air, we can't test it on the ground before we leave, and we can't test it again after we land. Okay, that gives us zero information about how the plane performs during flight. So keep that in mind and ask those questions when you're with clinicians who want to test you before and after exercise, and nothing in between, because that just don't make no sense. All right, hope that helps. Have a great day. Bye-bye.